Joining me now is Gemma Perry, owner and pharmacist of Sanders Te Awamutu and founding member of Prescription Access Initiative. Good evening, Gemma.
Oh, kia ora, Leah.
Kia ora, can you just tell us quickly what is Prescription Access Initiative?
So we're an advocacy group that was formed about 18 months ago when we could see the real effects that the co-payment was having in our communities. And we've done a whole bunch of research along with our pharmacy colleagues in New Zealand showing, first of all, when prescriptions all had a charge, we were really wanting to put that before the government and our communities to show what a big difference we felt it made when it was removed. So we did some research around that, and we've also done research showing the real benefits since it was removed on 1st of July last year. And now we would really love the government to change their position, and we have been working hard to try and keep this issue in people's front of minds and bring it to politicians' viewpoints as well, because we really think that the universal co-pay removal was so beneficial for pharmacy, for healthcare in all of New Zealand. It's a real shame today to see it come back.
Gemma, I just queried before I came to you that the government feels they might have got the right balance, free for over 65s. Is it 13 or 14 and under?
It's 13 and under, so 14-year-olds have to pay. And, that's a really good point, Leah, because, like 14-year-old with their inhaler, their parents have to pay for that. So it's, where do you draw the line? And a lot of people, not just us, but a lot of people, when they National announced this position during the election last year, really queried, well, where do you draw the line? And, National have admitted themselves that only some people who really need this help will get it through this scheme. This is definitely not going to catch everybody. Will be people falling through the gaps as of today.
Yeah, there was a study I'm sure you're aware of, from the Victoria University of Wellington, that people present more frequently at EDs when they can't get their prescriptions filled. More people going to hospital. Are you expecting to see this rise because of this?
Absolutely. Yeah, look, that evidence is really clear, Leah, and it's what we're hearing from our people in our EDs. They're reporting that they see that frequently, people presenting who would have avoided that visit if they had been able to access their prescriptions for free. And it's really disappointing that we've got decent New Zealand research from University of Wellington as well as Otago really linking those increased hospitalisations with the co-payment. And that's just one cost on the system, the hospitalisations. There's huge amounts of cost to pharmacy, to our GP colleagues in primary care, other parts of the health system due to this being brought back in. And we are concerned for our hospital colleagues on that pressure on them. This is coming in 1st of July, right in the middle of winter.
Yes.
I query the logic of the timing when we already know that we've got severe healthcare shortages in basically every field of health. And how on earth are we going to reach those targets that the government has set for, wait times in ED and even seeing a GP when we're just adding on another burden, another barrier to people accessing preventative care.
So when the previous government introduced free prescriptions last year, they said it would cost $618.6 million over 4 years. That is a lot of money that this government says they simply can't afford. Do you not buy that?
This is a matter of political will. You've seen them, the government, bend to a certain other type of political will recently in terms of tax cuts, and arguably a lot of people think those tax cuts are not going to who needs them. We really think the benefits of this were so far and wide that money, we argue, could have been found. It's just a matter of the government prioritising it, and they certainly haven't seemed to prioritise this at all. Clearly there's really good evidence for why this should have stayed free for everybody. And not only that, the public massively supported it. There was a poll that we commissioned in December that showed 86% of New Zealanders, this is across the political spectrum, supported universal free prescriptions for everyone. It is one of the most popular policies ever. So people did not want this to change.